Hi everyone, my name is Juliana Kha and I'm from the Bay Area in California. And today we will be exploring the link between angiogenesis and metastasis in cancer. But first, what is it that makes cancer such an enormous and critical field in pathology research? Well, first, according to the American Cancer Society, 1 in 3 women will develop cancer in their lifetime. And for men, unfortunately, you're not in luck because that chance is even worse. In fact, it's 1 in 2. And despite the clear prevalence of this disease, it isn't just common, it's very deadly. And with no clear-cut cause or cure or even complete understanding of its mechanisms, cancer remains one of the most enigmatic diseases to date. And so in this review, we will explore the relationship between two of its hallmarks, angiogenesis and metastasis. But first, what do these terms even mean? So, angiogenesis is the growth of new blood vessels, and it works via hypoxia-inducible factor, or HIF, proteins that bind to hypoxia-responsive elements. And then those are what induces the expression of angiogenic factors such as vascular endothelial growth factor, or VEGF. And then that's what stimulates the blood vessel formation and tumor angiogenesis. And it occurs because angiogenesis is necessary for tumor sustenance because while the tumor is small, it can rely on diffusion for oxygen and nutrient delivery, but that can only sustain about 100 to 500 micrometers. And so once the tumor reaches that limit, it experiences a lack of nutrients and enters a state of hypoxia. And so in order to avoid necrosis, the tumor has to turn to angiogenesis in order to maintain its growth and its sustenance. And so metastasis is the spread of cancer to a distant organ or tissue. And as you can see here, the metastatic cascade follows 5 main steps. So invasion, intravasation, circulation, extravasation, and then colonization of a distant organ. And metastasis is what poses formidable challenges to treatment efficacy and patient survival, and that's why it's the primary reason for cancer death. So now, how do angiogenesis and metastasis relate to each other? Well, you can take a look at this figure that I created in order to provide a more visual representation of healthy vessels in comparison to tumor vessels. And so, although tumors are able to utilize angiogenesis for nutritional supply, it's usually a process typically used in the body for things like wound healing, and therefore it's not meant to be used by tumors. So an imperfect execution of this process occurs, and that's what's causing the formation of characteristically leaky, malformed, and disorganized blood vessels, as you can see here. And this is because the pericytes, which are the cells that are responsible for structure and stability in blood vessels, they lose the ability to properly form and function due to a disruption of signaling pathways in the tumor microenvironment as a result of tumor angiogenesis. And so this lack of pericyte coverage here is what's enhancing the permeability of the tumor's vascular network, and thereby that's causing a leakage of the nutrients and causing a substantial decline in the overall efficacy of the vessels. And the leaky vessel structure is not only causing an imbalance in blood flow, but it's also allowing these green tumor cells here to enter and exit the bloodstream more easily, which is inherently promoting metastasis. And another way that tumor angiogenesis contributes to metastasis is through interstitial fluid pressure. So essentially, this breach of the vascular barrier creates an influx in the volume of fluid in the tumor microenvironment, and then that's therefore resulting in a high tumor interstitial fluid pressure. And a high TIFP can facilitate drug therapy resistance by inadvertently pushing the drug out of the tumor microenvironment, and then that's due to the high pressure of fluid. And so this outward force is contributing to metastasis because it's propelling malignant cells into the surrounding bloodstream and lymphatic vessels. And then subsequently, the tumor cells are able to spread to other regions of the body and establish metastatic tumors. So ultimately, why is identifying this relationship between angiogenesis and metastasis important? Well, it's providing insight into the understanding, and into understanding the underlying mechanisms of cancer, and it opens up a whole new approach to cancer therapy. So, for instance, there's currently research being conducted on inhibiting these angiogenic growth factors in order to prevent tumor growth in the first place, past diffusion. And so, if one of these methods one day helps or even saves lives, I'd say that's pretty amazing. And so, once again, my name is Juliana Kha, and thank you so much to my mentor, Amy, and thank you so much for listening.